Well, Sunday kicked off National Hospital Week, and this week is dedicated to recognizing and celebrating our hospitals and healthcare workers. When most of us think of hospitals, we think of the doctors and nurses, but in reality, there are so many others who help provide patient care. And joining me now is one of those workers. Kasey Wichael is an X-ray supervisor from North Suburban Medical Center. Thanks so much for joining us today.
Hi, thank you.
It's great to see you. Okay, so how long have you been an X-ray supervisor, and what does that job entail?
So I've been the supervisor since November. I've been an X-ray for approximately 12 years.
So what are some of the things? Oh, I'm sorry.
You're fine. It entails, basically, we're the eyes of the hospital. We respond to all stroke alerts. We respond to all traumas, all cardiac alerts. We're a huge part of the hospital because we help the doctors see inside the body. Any questions they have, anything they need to know, they're ran over to CAT scan, they're ran over to X-ray. We respond to those rooms to take immediate X-rays so that the doctors can see the lungs, the heart, see any broken bones, anything like that.
What made you so passionate about this job?
I love it because, one, I'm helping people. I meet new people all the time. It's very diversified, and it's changing all the time. Not only am I just X-ray, but we are a huge part of the ER as well. We help the nurses a lot with traumas, getting patients into different rooms. We all help each other really well. So just that camaraderie and the teamwork is really what fuels that, and then helping patients get diagnosed and get treatment.
So we have some photos from you and your personal life, of course, of your family. Is it difficult to balance that work life, or that work and then your personal life too?
It definitely can be, especially when you have a hard day and you go home and you have to set all that aside because your children don't understand what you saw or what you did or what you were a part of. So setting that aside to be able to have that personal life at home with them and have a good one is very important.
And quickly, if someone wants to get into this field and they're watching this at home, what do you say to encourage them?
I would encourage them to go and get an entry-level job at a hospital. There's a ton of registration jobs. There's tons of front desk, transport. There's so many jobs that you don't need necessarily a degree or a certification to be able to just come into the hospital and get your foot in the door and find out what you really love and like.
And it seems that you're really loving it. So thank you so much for taking the time out to talk to us today.
Of course. Thank you so much for having me.
And of course, thank you for all the work that you do as well. And remember, you can watch all of our health interviews right now on CBSColorado.com.